the thing, because we were discussing about blood sugar, right? Yeah. Now, the vitamin C is not as effective if you have hyperglycemia. Yes. Now, vitamin C is a very important vitamin, and most people, they have used it for several purposes. And Linus Pauling was the first one who used it for cancer purposes, and he used it up until some there were because I have his book, and it was in that book. It says he was giving it 100 grams per day. Yeah. So, but again, if you're gonna do this, it has to be under a supervision of a doctor. Okay. Now, vitamin C is it's a very amazing vitamin. Okay, and for me, it's a master vitamin because it increases the immune response of the body. It increases the phagocytic activity of the cell. Phagocytic means the one that eats all of your bacteria, eats all of your cancer cells. It increases that. Okay. Now, but this is the thing, because we were discussing about blood sugar, right? Yeah. Now, the vitamin C is not as effective if you have hyperglycemia. So you have to correct your hyperglycemia first before the vitamin C can effectively do its function. Okay. Now there's a study. Okay, there's a study that you can use the vitamins. That vitamin C is very beneficial at the dosage of 10 milligrams. Imagine 10 milligrams, as low as 10 milligrams, okay? And it improves the lifespan of, particularly of males. It enhances the lifespan of males 6 years if they take in around 300 milligrams. But if we are sick, especially me or you or whoever you are, if you are sick, we can take up until 1,000 milligrams or higher. Again, this is with the supervision of your doctor. Okay? How ba ang maasim? Okay, they're asking if the sour is bad for people who have problems in the stomach. Okay, now not really. It depends on someone. Like vitamin C, diba? They kept asking, like, especially ascorbic acid is bad for people who have duodenal ulcer or gastric ulcer. Apparently,
that's not what the science says. That's not what the science says.
Yeah.
That's been studied scientifically, and the studies have shown and demonstrated that it's good for that.
It's good for you. Okay, how many percent? If I'm not mistaken, 30%. Okay, of people who are taking vitamin C is actually improved. Okay, using your vitamin C. If you have problems with your ulcers, duodenal ulcer, yeah.
In fact, a quick question, Mom. When it comes to the body, if our body, we are missing the gene expression that allows us to produce vitamin C in the body. But if we were to produce vitamin C in our body like most every other animal on the planet does, what is the type of vitamin C that our body produces?
Ascorbic.
Ascorbic acid.
You know, we are the only, not only, we are the few people
one of very few creatures on the planet that does not produce vitamin C internally. And the creatures that do produce it, they produce in their body ascorbic acid. So when folks are trying to recommend, you know, sodium ascorbate or all these different types of vitamin C's, you have to understand that the one that is produced in nature is ascorbic acid.
Yeah. So again, tayo lang po, I mean, as fish,
a fruit bat, very few
people who have lost that capacity to make vitamin C.
For example, your dog makes vitamin C, your cat makes vitamin C, your goat makes their own vitamin C in their body, cattle make their own vitamin C in the body. But we basically lost that gene that does that, which is why we have to intake it. You have to take it in.
That's very important, the vitamin C. If there's one thing that, you know, when we part ways today, if there's one thing that you have to look and you have to internalize its vitamin C. It's actually one of the, diba, there's even one, if you're in the group, the cancer patient support group, he was just taking vitamin C. It's Shanda Gohoy. Right? Hello, Shanda Gohoy. Like, he took a screenshot of his nephew who was taking the vitamin C. Diba nakita nyo, ang laki-laki? Yeah, no, it was a mass on the, underneath the, on the neck. And then he's just taking vitamin C, diba? Hi, Sir Rick Cantrell. Yeah, he's just taking vitamin C. And it just, the lymphadenopathy is shrunk. So that's how important vitamin C is. So again, if we're gonna separate today, if there's one thing that you have to take in, it's vitamin C. It's very important for all of us. Actually, when we are stressed, our vitamin C has to be, we have to take in a lot of vitamin C. Like, if we are stressed.
I'll explain that. Like, for example, a 70-kilogram adult goat, they'll produce about 3.5 grams of vitamin C internally every day. If they are stressed out, and again, this is all in scientific studies, which we'll be putting on drfarrah.com, I believe, this next week. So when that adult goat is stressed out, it'll produce up to about 13 grams of vitamin C per day. So if it will normally produce 3.5 grams, it makes one wonder, why is our recommended daily allowance in the milligrams? If a goat will produce 3.5 grams per day, why, as humans, is our recommended allowance in milligrams?
Yes.
Food for thought.
And our vitamin C, the Dr. Farrah vitamin C, has no fillers. Okay? Walang filler yan. So I think the best thing for everyone else is to take a pure dose of vitamin C. Yeah. Rick Cantrell said Dr. Pauling got the Nobel Prize for proving mega doses of vitamin C cures cancer. Yan sabi ni Sir Rick Cantrell. Dr. Rick Cantrell. Hello, Dr. Rick. I missed you already. Yan.
Is it safe for them to take vitamin C?
It is. It's safe for you to take vitamin C.
Because does vitamin C cause kidney stones?
No, it's not.
Is there any study that definitively shows that in the some history of medical literature in history that shows that elevated levels of vitamin C cause kidney stones?
No, nah.
It's anecdotal old wives' tale. You were taught that in medical school, weren't you?
I was taught, yes.
Without evidence.
But then I started giving it also to my patient. And I'm giving it mega doses pa nga, diba? 20 grams. And in some cases, they would, if the effect is not evident, they would take around 40 grams pa nga. So, and they would take it for a couple of months. Wala naman silang, wala naman nag-develop ng stones. As far as I know, that's it. I'm just talking about myself, my experience, because I don't want to influence other people as well.
Well, I can tell you there is no definitive study showing a causal link in the history of medical literature.
So this,
and it's a required nutrient.
Yeah, vitamin C is a required nutrient.
So how can it be good and bad?